With liposuction, patients have a choice of anesthesia. They can be fully awake, in which the anesthesia is all done through local anesthetic, and we call that tumescent liposuction. The second option is to do the tumescent, which is the primary source of anesthesia, and have the anesthesiologist put a little IV in and give you some pain medications and sedation. And then the third is to go totally asleep. What you find is that there are doctors who have strong preferences for one or the other, and there are patients that have strong preferences for one and the other. Now it's interesting, if you talk to a doctor and you see what they're suggesting that you do, you need to think about what options are available to that doctor. In other words, given the economics of medicine now, there are a lot of people throwing their hat into the liposuction ring and dabbling with liposuction who do not only not have the training for it, but they don't have access to an operating room in which they can perform it and legally give anesthesia. So there are a lot of doctors who are saying, oh, the only way to do it is tumescent, the best way to do it is awake. Not true at all. It's not the best, it's not the most accurate, it's not the most comfortable, and it's not the safest. It can be in certain situations, but don't let anybody talk you into that. I give patients a choice. It's funny, some patients come in and they go, oh my God, I don't want to have any pain at all, I don't want to have anxiety, just have me put to sleep and wake me up when it's over. Next patient comes in and says, I don't want to go to sleep, I think it's scary, I want to be awake, I want to know what's going on, I want to be in control. So a lot of it has to do with those issues. It also has to do with where you're doing it on the body. For instance, a male chest can be very sensitive. You can do it under awake tumescent anesthesia, but it's often uncomfortable. The outer thighs on a woman can be done very comfortably when they're awake. And of course, it depends upon each patient. You see, it's interesting. The fat itself has very little nerve endings. The nerve endings are in the skin above and either the bone or muscle below. So when a patient is thicker and you're kind of in the middle of this thick layer, you're causing them very little discomfort because this fat, even unanesthetized, let alone anesthetized, doesn't feel very much. So if you feel like you're going to be stretching the skin or the tissue below, then it hurts more. So the conclusion of all of this is patients have an option. You should discuss with me or any surgeon you see based upon what you're having done, what will be the safest for you, and what will make you the most comfortable.